called Hit and Run Education here. We got 10 minutes to get across a whole lot of information. So, my name's Elizabeth Rood, and I'm a parent here at Sauganash.
Hi.
Hi. Hello. I'm here to talk to you today about a disease called diabetes. When I was little, okay, anybody else know someone with diabetes? Ever heard of it?
My uncle, my aunt, my second cousin.
There you go. You know a lot of people.
I have.
Okay. So you all know somebody with diabetes, and I'm one of those people. When I was 12 years old, I was diagnosed with insulin-dependent type 1 diabetes, and my world changed forever. And the biggest thing that I was concerned about at that time was what kind of grades I was getting in math, or why my parents were coming down on me so hard, or if this guy or that guy liked me. Overnight, my priorities changed, and I had to realize that I had to take care of myself to literally keep myself alive. I often know somebody that has diabetes, and the reason you should know about the disease is because it is so rampant. And if you know the symptoms, if you know the signs, if you know the complications, you can help somebody who has diabetes if there's an emergency. You may be able to spot the symptoms in a friend or family member or yourself to be able to get them to go in and get tested, because early treatment is your best defense against diabetes. So, quickly go into what diabetes is. It's a disease where your body does not properly use the energy from the foods that you're eating. When you all had breakfast this morning, and I hope you all did have breakfast. I didn't. Well,
I didn't have a
I like 5 Krispy
I never
Kremes. All right. Well, what happens? You eat food, it goes into your system, and it gets broken down into a simple form of sugar called glucose. Your cells need glucose in order to function properly, to create energy, to build muscle, to make fat. So, after it's broken into glucose, it's got to get into your cells. Your pancreas, which is an organ behind your stomach, produces a hormone called insulin. The insulin goes right out, grabs the glucose, and can get it into all the cells where it's needed. So that's not in your sugar, in your blood, and in your urine. And then your blood sugars stay normal. And the normal blood sugar rate is 70 to 120. My body, I have type 1 diabetes. My body does not produce insulin. So in order for me to keep my sugars level, I need to inject insulin, just like to mimic what your body does. There's a second kind of diabetes, which is more prevalent than type 1 or juvenile onset diabetes. Type 2 diabetes. And it used to be called adult onset because only adults were getting it. But unfortunately now in the United States there's an epidemic of type 2 diabetes in younger kids. And I'll explain why in a minute. Type 2 diabetes is when your pancreas is producing insulin but not enough for your body, or your body has become insulin resistant. It's not using it properly. So your sugars become elevated. That gets treated with diet, exercise, oral medication to make your pancreas produce more insulin, and on occasion also shots. The reason it's developing more in the teenagers is because we're much more sedentary. More people are sitting in front of the TV, sitting in front of the computer, sitting in front of the Game Boy, instead of getting out and exercising. We've got a society where more people are overweight. We're eating fattier diets. We're supersizing everything. That all contributes to diabetes. So you got to know that the choices that you make, your lifestyle choices, will affect your health and can affect it in very drastic ways. Again, with me, with type 1 diabetes, I'm living proof that if you take good care of yourself, live a long and normal life. I've had diabetes for 28 years. I have absolutely no complications, but it's a real regimented way of taking care of myself. Yes?
Do you eat like fast food like once in a while? Is that?
No, every once in a while, everything in moderation. That's what's important. With diabetes, if you don't take care of it, there are complications, and they're life-threatening complications. Some of the major complications with diabetes are retinopathy. It's a disease of the eye. The blood vessels start leaking. It's the leading cause of blindness. You have heart disease, heart attack, stroke, kidney disease, where you end up on a kidney dialysis machine, and neuropathy, which is the disease of the nerves, where you start losing sensation in your feet, your legs, your fingers, and it's the leading cause of amputations in the United States. So again, these are serious complications, but if you're committed to taking care of yourself, you can, as I say, be a very, very healthy person. I'd like you to know a little bit about some of the symptoms of diabetes, because you may develop it, somebody you know may develop it. You may be able to help somebody realize they better get in to see the doctor. Some of the symptoms: increased thirst, increased hunger. You're eating more. You're feeling hungry even after you've eaten. Your mouth is dry. There's a sweet taste in your mouth. You're going to the bathroom a lot more than normal. You feel tired all the time, weak, fatigued. You could have blurred vision. You could have unexplained weight loss. You could be eating normally and all of a sudden dropping tons of weight because you're eating foods and it's not getting processed. It just gets washed right out. And if you cut yourself and you realize, you know, I'm not healing as quickly as I normally do, that's also a symptom of diabetes, and you should be aware of it and say, maybe I better get in. Yeah.
You cut yourself and you're not getting
Yeah, that's a different technique. But again, if you have that that's not related, no, not to diabetes. And also, diabetes is not something that is contagious. It's a problem within your own body. They don't know what causes diabetes at this point in time, but there are some risk factors that you should be aware of. If you have diabetes in your family, you've got a higher risk of developing it yourself. There's some ethnic, racial backgrounds. Your risk of diabetes increases if you're Hispanic, African American, Native American, or Asian. If you are overweight, if you're 20% more above your normal weight, that's a contributing factor to diabetes. Alcohol, severe alcohol use, and smoking can contribute to the development of diabetes. And now they believe that viruses can play a part in developing diabetes as well. It's important to note that eating sugar does not cause diabetes. It causes a lot of cavities, but that in and of itself doesn't cause diabetes. There are two conditions with someone with diabetes that it's good for you guys to be aware of in case, again, you know somebody with it or you know it yourself. Hyperglycemia, which is high blood sugar level, and hypoglycemia. My sugar level goes low. I need to raise it up. I'm very good at detecting my symptoms. Other people with diabetes are not. And it's important for you to be aware what symptoms are in case somebody's acting strange. And you can say, test your sugar. You may need some your blood sugar. You need to get some sugar in here. Some of the symptoms with the low blood sugar, for me, I feel kind of dizzy. I get sweaty. I can't concentrate real well. Sometimes I get mad for no reason whatsoever. Other symptoms for people is their vision can get kind of blurry. They can act as if they're drunk. I mean, it's a loss of control of their faculties. And if it doesn't get treated, they can pass out.
Has anyone died of diabetes?
Yep. And especially with high blood sugar, the hyperglycemia, you can develop a condition called ketoacidosis, which is diabetic coma. If you come across somebody who's passed out, you know they have diabetes, smell their breath. Because if there's a sweet smell to their breath, you know it's because their sugar level is high. Call 911. You get emergency people there say, hey, it's diabetes, and smell his breath. And they'll be able to get insulin and bring it out of the coma.
If you want to know your blood pressure, do you do it? Then you look at your blood on your...
Yep, and I'm going to ask for a volunteer in just a minute to test the blood sugar in that. And again, it's a little pinprick. It's what I do 4 to 6 times a day. So I can't get everybody in on this, but we will try. Again, with the low blood sugar, the fastest way to raise your blood sugar is to drink orange juice. 4 to 5 ounces of orange juice. I carry with me all the time something called glucose tablets. They're like giant sweet tarts. I pop 3 or 4 of these, and my blood sugar goes right back up. Right. Hard candy. Okay, with 2 minutes, who's going to be my volunteer to get this? So, you guys want to come up and take a look? Although don't block our guy here. Okay. There's a little lancet in here. It's a fresh one, you bet. Okay, are you left-handed or right-handed? Give me your left hand. You poke the sides of your fingers because it doesn't hurt as much there, okay? Cock it back. There's going to be maybe a little pinprick, okay?
I didn't even feel it.
Right. So, then we squeeze.
Oh, wow.
Get the blood.
That's right. The smallest cuts do bleed.
Yeah.